I think it was the work of my father, not necessarily kick-started it, but certainly that he was one of the major advocates of looking at the question of what sugar did to you in terms of metabolism, what diseases it was associated with, and ultimately, as a result of his research over quite a number of years, he came to the conclusion that it really was a dangerous foodstuff. His book was called Pure, White and Deadly. It was published in 1972. It summarized really for an intelligent lay audience the kind of work that he had been doing, the kind of work that other people had been doing in different parts of the world, and made a very convincing case, I think, for the view that one has to be very careful about the amount of sugar that one ate, and actually eating none was probably best of all. The book was ridiculed to a substantial extent. It was really the subject of a hatchet job, largely by the food industry. And although many people individually bought it and were interested in it, and even today people come up to me and say, was it I that wrote the book? And I have to say, no, it was actually my father who wrote it. So there was obviously a lot of interest in it, but at a professional level, I think it was poo-pooed and he was regarded as a bit of a crank. We hear a lot about fat, we hear a lot about salt. We don't hear enough, in my view, about sugar, and certainly nutritionists would do well, I think, to inquire into the diet of people who consult them, and also should themselves spread the message about sugar, because it is an inessential component of the diet. There is no reason that we have to have sugar. We have to have this, we have to have that, but we don't ever have to have sugar in order to function healthily. I'm not sure to what extent my father would have thought it a good idea that government should regulate food and in particular sugar and sugar-containing beverages, for example, because I think in his days it was generally thought that if you explained to people individually that a particular component of their diet wasn't doing them much good, that would be enough to diminish their consumption. We now know, I think, as a result of work over the last 30 or 40 years, that such attempts to influence people individually are not at all successful. And it may be that, as we have done with tobacco, there has been a lot of taxation, there's been a great deal of propaganda against tobacco. We may now have got to a situation where the number of diseases and the severity and frequency of the diseases associated with the consumption of sugar has got so bad that we have to take further efforts. That would be the way to do it, I think.